Radiating pain or sciatica is a very frustrating pain to deal with. This type of pain comes from your lower back, comes into the glutes, down the back of the leg, into the calf, and into the foot and toes. So what we are going to do today is try and centralize the pain. So if you are feeling referral pain down into the calf, what it will do is bring the pain back up to its origin, the lower back, trying to get the nerve to mobilize through all these movements. Remember, in these classes, I want you to take the regressed version rather than trying to overdo it and overstretch. Do the simple movements to make a better result. We're going to start with a pre-assessment. First assessment, lying on your back and then taking the right leg up. See if you can take the leg straight. If you can't, just bring it to as far as you can, where you feel your limitation is. And if you can take it all the way, try and take it as far as you can, hands behind the knee. And then switch legs. So again, if you can only lift it up a little bit, that's as far as you can go. But remember this feeling and also focus on the difference between side to side. Our second assessment is taking the leg up and all the way over and trying to feel that spinal mobility or that stretch or sensation down the back or side of the leg. Come back to center and switch, taking the leg all the way over, feeling the sensation down the legs. And then come back up. So let's get started. We're going to start with using our toes, trying to hold onto your big toe and pulling it back and forth. This is going to mobilize into the sciatic nerve. Everything we do today will help you get more range of motion through this sciatic mobility. 3 more, 2, and 1. Switch sides. Take the big toe and pull it back. Keep going. 2 more. And last one. Come back again with the other foot. Now we're going to pull the foot in and pull it out. Just doing these rotations with the foot will help start mobilizing the sciatic nerve. 3 more here. Pull it in. 2 and 1. Switch. Pull the foot into. Feel that stretch in the side of the ankle as you do this. 3 more. 2 and 1. Now coming onto your knees and having the feet directly behind you. Don't have the toes in and the heels out. Keep the heels directly underneath the bum and the toes pointing backwards. In this position, you're going to lift the knees up. If you can't lift them up, just take it one step at a time, trying to lift one knee at a time. And you'll start to notice side-to-side differences here. If you can lift, then just bring the knees all the way up. If you're going one at a time, just keep going. Take the hands down if you need. 2 more. Last one. Come forward and then just slowly tuck the toes underneath your heels. So you want your toes to be directly underneath your heels and all the toes must be facing forward. Even look between your legs to see where your toes are at and make sure the big toe is not turning inwards. In this position, I want you just to try and lean back onto your heels, if you can, keeping that foot in a straight alignment here. just pushing back onto your heels, and if you don't need your hands, you can just move it here. 5 more. 4, 3, 2, and 1. Coming back again, tucking the toes, and then seeing one by one. It's going to be more difficult to move through here now. 5 more. 4, if you're going both legs. 3, 2, and 1. Again, tucking the back toes. Remember, you can use your hands here, or you can take your hands to your knees, and eventually you can take your hands off and then just hold it, pushing the bum back down onto the heels to get that toe flexion there. 3, 2, and 1. Come onto your hands and knees, and then take the left foot back. Now that we've got that toe flexion, I want you to push the heel back and forth, stretching now into your calf muscle. This is where your sciatic nerves comes through. So pushing the heel all the way back. If you can take it further from this position, I want you to come into a downward dog and try and get the heel down to touch from here. Pushing your bum up to the sky as you take the heel down towards the mat. 3 more. 2, and 1. Come back down and switch sides, taking the right leg back and just pushing the heel to the back of the room and forward. Remember, if you can take it a step further, then push the bum into the sky and push the heel down to the ground. Remember, pushing the bum high into the sky. 3 more. 2, and 1. Taking down onto your knees and then trying to come all the way, lifting the knees off of the ground, pushing the heels and pushing your chest to the thighs. 1, 2, 3, 4, last one, 5, and then come down onto your back. So lying on your back, take the right leg up into the sky. If you can, lift it to as far as you can, and then just try and lift the leg using your hip flexor here. So keep your core engaged and lift as high as you can. 3 more. 2, and 1. Take the leg down and switch for the other side. Just lifting it as far as you can. Feeling that hip flexor engage. 3 more. 2, and 1. Take the opposite leg into the sky, and then you take your arms out into a T position. Lift the leg and switch it over the body and back and down. Lift the leg, take it over to this other side and back and down. That's 1. Lift. Take it over, core engaged, pulling the leg back and down. Reach across the body. 2. Go only as far as you can to control the movement back. So remember, you don't need to go all the way, even if you're just moving a little bit there and back. Good. And 4. Last one to each side, reaching up, taking it over, bringing it back and down, reaching up, taking it over, bringing back and down. And now hug the right knee into the chest. Try and bring it in as far as you can, and then try and straighten the leg in this position. If you're just lifting here, that's okay. We're stretching through the hamstring. This is the second area that the nerve glides through. Keep going. 3 more. 2 and 1. Switch sides, taking the left leg in and lifting up and down as far as you can. 3, 2 and 1. Take the left leg down, bring the right knee back into the chest, hug it in, and then you're just going to do some mobility into the spine. Just taking the leg over the body as far as you can. And keep noticing the side-to-side differences. So if you have more pain or more tightness on the one side, you can actually focus a little bit more there. And then come back to center, switch sides, bring the left knee into the chest, take the right leg down, and switch over. Only small movements to get the nerve moving. Keep the core engaged as you take the knee over and keep twisting. Two more. Last one. And then come up into a kneeling position. So in this position, I want you to take the left leg forward. If you feel like you can't straighten your leg in this position, you can have a slight bend and place your hands into the hip crease. And you're going to move forward and back, pushing your hands into the joint or into your thigh to push the joint backwards. This is mobilizing the nerve over the ischial tuberosity or your sit bone. 3 more. 2 and 1. If you can straighten the leg a little bit more, make sure your core is engaged. Push your hands into the hip and move forward and back. 4 more. 3, 2 and 1. Switch sides. Starting with the knee bent and then just pushing your hands into the hip crease. Try and go as far as you can, pushing the hips backwards and then straightening the leg if you can, or just holding into the first movement. 2, 3, 4, 5. Good. Now we're going to come to our post-assessment. Lying on your back and seeing how far you can take your leg this time. See if you can take it that little bit further than you did at the beginning of the class. And switch sides. See how the movement can be a lot easier now that we've mobilized through the whole nerve. And then taking the leg all the way over and back. Same thing with the left. And come back up. So if you noticed side-to-side differences, I want you to redo the class and focus on the side that was tighter. And then keep doing this to help relieve that radiating pain and centralize the pain back to the lower back.